Hello friends, today we'll discuss one more important topic related to the female reproductive system, that is the anatomy of the uterus. This is Dr. Yusuf signing from the Al Jof University. This is the specific objective which is related to this topic, that is describe the anatomical relations, peritoneal dispositions, pouches, lymphatic drainage, supports, ligaments, list the blood supply as well as innervation of the uterus. So these are some of the important parts on which we'll be discussing today's topic. To begin with, as you know, uterus is a very important part of the female reproductive system. This is a accessory reproductive organ which is mainly it acts as a childbearing organ. The synonym for this is womb. It is also said as womb in the language, as well as in Greek it is called a histra. So whenever we talk about cutting and opening of the uterus, that is called as the hysterectomy, and complete removal of the uterus is called as hysterectomy. So all these start from this histra. So as I said, this is a very important childbearing organ which is highly muscular as well as hollow. You can see this is the uterus here, and you can see a thick wall, a very thick wall which is highly muscular in nature, and these muscles also have the typical feature that whenever the fetus start growing within this lumen, if you can see here, we have a very thin small lumen which will be later which will give rise to a big space where actually the fetus will be growing as well as developed up to 40 weeks. So whenever the fetus starts growing and it occupies more space, so the muscle of the uterus has the capacity to hypertrophy as well as the hyperplasia. That is, it not only become larger in size, the muscle fibers, but also they have the capacity to replicate themselves. So this is a very important feature of the musculature of the uterus. So it is highly muscular, as well as you can see there is a small lumen, and this is a very important childbearing organ in case of the female. If you see the situation, as you know, this is a pelvic organ. When it is non-pregnant, in the non-pregnant uterus, it will be pelvic organ, but during pregnancy, as I said, as the fetus starts growing within the uterus, it becomes an abdominal organ when the uterus expands to a very large size. So this is a pelvic organ, and it is stuck between in the front by the bladder in the front, and behind will be the rectum. So it is between the bladder and the rectum. So in between will be the uterus as well as the vagina. So this is a pelvic organ, and the shape is almost pyriform in shape, and because of the important organs in the front and the back, that is the urinary bladder in the front and the rectum behind, and these themselves have the capacity to expand to a large extent depending on whenever they are full. So this is stuck in between, and it is flattened before backwards. And the size of this uterus is almost in inches, 3 inches into 2 inches into 1 inch. That is, the length is almost 3 inches in length, and the breadth is almost 2 inches, and the thickness is almost 1 inch. So it is 3 into 2 into 1 in inches. So it's a very small, it is just 3 inches in non-pregnant uterus. This is, you should remember, this is in the non-pregnant uterus, it will be almost 3 inches in length. But once there is pregnancy, then, as I said before, it has the capacity to expand to a very large extent, and it becomes so huge that it enters the abdomen, and later in the later stages of pregnancy, it will almost occupy most of the part of the abdomen. And the weight in non-pregnant uterus, it will be almost 30 to 40 grams, which is very small in size as well as the weight is very less, but again during pregnancy it becomes huge. Coming to the important divisions of this uterus, broadly it will be divided into a larger part, upper 2/3, which will be almost 2 inches in size out of the 3, and this is called as the body of the uterus. This is the body of the uterus, almost 2/3 of the uterus. The lower part will be called as the cervix. So this is the lower part, which is cervix, and these two parts have some features which are in common and some features which are different. So that's why the lower part, which has the capacity to a lesser extent to actually enlarge as well as hypertrophy as well as the hyperplasia. So this part will be called as the cervix, and the upper 2/3 will be called as the body. Uh, Apart from this, the body itself is again divided into a part above. This will be called as the fundus, which is above the opening of the two uterine tubes or the fallopian tubes, where they are opening. Just above that part will be called as the body, the fundus, and the lower part is called as the body, and lower 1/3 will be called as the cervix. This cervix, how to identify the cervix? It begins from there is a narrow constriction between the body and the cervix. This is called as the internal os, a very important structure clinically. We'll talk about that. So this is called as the internal os. So this is the beginning of the cervix, and it ends in the vagina here as the external os. So it has an internal os, it begins from the internal os and ends in the external os. So the upper 1/3 of this cervix, this is called as the isthmus. So this is a narrow part of the cervix, that's what is called as isthmus, and this is very important clinically because this is the area where they do the LSCS, that is lower segment Cesarean section. This is very important clinically because this is the site where they do the CS, that is the Cesarean section. Coming to the communication, as you know, on the medial side it will be opening downwards, and superiorly it will be opening into the uterine tubes, and below it will be opening into the vagina downwards. So you can see in this picture, so this is the area, so this is the uterus, this is the lumen of the uterus. It will be communicating through the vagina exteriorly and internally into the peritoneum through the uterine tubes, and through that into the peritoneal cavity. So this is the communication of the uterine cavity. Coming to the normal position, it has a very typical nature or in a typical position on which it will be standing, and that position is very important. This is called as the anteverted as well as anti-flexed. So anteverted as well as anti-flex. If you see here, this angle between the vagina and the cervix, this angulation, this is almost 90°, and this is called as the angle of anteversion or anteverted. Then there is another angle that is between the cervix and the body of the uterus. So that angulation is called as the angle of anteflexion. Angle of anteflexion, this is almost 120 to 130 degrees, and this is called as anteflexion. So this is the normal position of the uterus, anteverted as well as anteflex. Even though it looks very abnormal, but this is the normal position of the uterus, and this is very important. Again, as I said, clinically this is important because this is the position this uterus should be, and if it changes from this position, then it leads to a lot of complications. We'll discuss about that in the applied anatomy. So the long axis of the uterus, if you see, so there are different long axis. The long axis of the uterus is in this direction, and the long axis of the cervix is in this direction, and the long axis of this vagina is in this direction. so it is directed downwards, forwards. Okay, so if you see these different angles, this look again very abnormal, but if you see the uterine axis, this is very important axis, because this is the angulation at which even the pelvic inlet will be opening. So it corresponds with the axis of the pelvic inlet. Similarly, if you see the direction of the vagina, the long axis of the vagina, it will be corresponding with the pelvic outlet. So this is according to the pelvic inlet as well as the outlet. So even though it might look very abnormal, but this is the normal position, and this is the best position for this uterus cervix as well as the vagina. So you should remember the normal position of the uterus is anteverted as well as antiflex. Anteversion is between the cervix and the vagina. This is called as anteversion, and the anteflexion is between the long axis of the uterus as well as the long axis of the cervix. Okay. Coming to the ligaments of the uterus, there are important ligaments which will be holding the uterus in its position. So there are two types of ligaments. One is the peritoneal ligaments as well as the fibromuscular ligaments. So the peritoneal ligaments are very thin ligaments. These are nothing but the folds of the peritoneum itself. So if you can see here, this is the pelvis, and here you can see the bladder, the uterus as well as the rectum, and here you can see this is the fold of the peritoneum, which is dipping downwards, covers all the way the anterior surface, the fundus as well as the posterior surface of the uterus, and it is folding. Again it will reflect back from the on the rectum. So these folds are very important, and these are called as the peritoneal ligaments. So anteriorly we have a fold of peritoneum which is related to the utrovesical pouch. So this is called as the, because it is between the uterus as well as the vesica. Vesica means bladder. So this is called as the vesico-uterine pouch or the utrovesical pouch. And there is a fold of peritoneum here. If you can see, this is the fold of peritoneum which is hanging and reflect back. So this is called as the anterior ligament of the peritoneal fold. So the anterior ligament consists of the utrovesical fold of the peritoneum. Okay, so this is the fold, this is called as the anterior ligament. Similarly, if you see here, this is the pouch here. This is a very important pouch. This is called as the recto-vaginal pouch or recto-uterine pouch. This is also called as the pouch of Douglas. So this is a very important pouch, and here also there is a fold of peritoneum which is reflecting here. So this is called as the posterior ligament. And then these folds not only cover the uterus, but they will go beyond on the fallopian tubes, and they will be hanging on either side of the fallopian tubes. Okay. So if you just stretch your hands, and if you imagine that there is a cloth put in the front of you as well as back of you, covering you as well as your hands, it will be similar to that. Okay, yourself will be the body of the uterus, and the two hands will be the fallopian tubes, and the cloth which is put from all over from front as well as behind, which is hanging even on your both the hands, that will be the fallopian tubes, and that fold will be the broad ligament. So this fold of peritoneum which is hanging over the fallopian tubes and downwards, that will be called as the broad ligament, because there are two fallopian tubes on either side, so there will be two broad ligaments. So these are nothing but the peritoneal folds. Next, there are very important other ligaments. These are called as the fibromuscular ligaments. Fibromuscular ligaments. After the peritoneal folds, there are important strong ligaments. These are called as they are fibrous in nature as well as muscular in nature. So they are called as fibromuscular ligaments. So which are those? One is the round ligament of the uterus, a very important ligament. This will be here, if you can see in this picture, below this peritoneal fold, there is one ligament, strong ligament, round and thin ligament going across. So this is called as the round ligament of the uterus. The second ligament is called as the transverse cervical ligament. In other pictures will show you how exactly it looks like. Then there is also something called as the uterosacral ligament. So these are all ligaments. We'll show you the other pictures with which you can appreciate the presence of these ligaments. So there are two types of ligaments, peritoneal ligaments as well as the fibromuscular ligaments. So among these ligaments will be helping in this the position of the uterus. Though later we'll come to know why the support of the uterus is very important. So all these ligaments will act as the supports of the uterus, but they are divided into two types. One is the primary supports and secondary supports. Primary supports will be muscular in nature as well as the fibromuscular in nature. So supports of the uterus will be not only ligaments, but there are also additional structures which will all, even the position itself will be acting as a very important support, which help in its normal position as well as in its keeping in its position. Okay, so the supports of the uterus are divided into primary and secondary. The primary are muscular, as well as the second type within the primary will be the fibromuscular. So what are the muscular ligaments or the supports? These are, one is a very important diaphragm below, that is called the pelvic diaphragm, a very important muscular diaphragm which is present, which is supporting the rectum as well as the vagina and all the structures which are in the perineum. So here, so these all these muscles together, these are called as the pelvic diaphragm. All these muscles meet at a particular point here, which is between the vagina and the rectum. This is called as the perineal body. A very important body, again clinically very important. If during birth of the fetus, so if, during the excessive enlargement, if there is a big baby or some other thing which will expand the vagina to a very large extent, that can rupture the perineal body here. Okay, so there is a very important body here, which is nothing but, again, it is a muscular body where all these muscles come and meet. So that is the point where all the muscles will come and meet. That is called as the perineal body, which is between the vagina and the rectum. And if it is stone, then it leads to something called as prolapse. Prolapse of the uterus is very important, so which will be common because of the tear of the perineal body. So how to prevent it, again we'll discuss that later. Okay, so this is the second important structure, which will be the primary support. As I said, if it is stone, then it will lead to the prolapse. So the primary support is the perineal body also. The third is called as the urogenital diaphragm. There is also a diaphragm above that will be called as the urogenital diaphragm. We'll see the later pictures where we can appreciate how exactly the pelvic diaphragm and the urogenital diaphragm. So there are three important muscular supports which are the primary support, that is the pelvic diaphragm, perineal body as well as the urogenital diaphragm. Pelvic diaphragm is here, muscular diaphragm with lot of muscles here. We'll not go into detail, we'll study that when we study the perineum itself. The second is the perineal body, which is, as I said, it's a very important muscular body where all these muscles come and meet, and that is a very important site which is between the vagina and the rectum or the anal canal. It is better to be more specific. It will be between the vagina and the anus or the anal canal. Okay, so it will be a important muscular body. The third is the urogenital diaphragm, which is deep inside. Okay, then the second type of the primary supports are fibromuscular. So what are those? One is this is not even fibromuscular, because this is called the uterine axis. As we have seen, the normal position of the uterus is the anteflexion as well as anteversion. That position is very important for the uterus to be in its normal position. If, as I said before, if this anteversion and anteflexion is changed, then it leads to prolapse itself. Okay, so that's why the normal position should be maintained, that is the called as the uterine axis. Then the second is the pubocervical ligament. There is a very important ligament which is between the cervix and the pubis. This is the pubic symphysis. Beside that, this is the body of the pubis and other things. So this ligament will be running from the cervix to the pubic bone. So that's why this is called as the cervical ligament. So this cervical ligament, because it is running between the pubis and the cervix. Then there is the third important ligament, that is called as the transverse cervical ligament. Okay, so again this is between the cervix and the lateral wall of the pelvis. So that's why this is called as the transverse cervical on either side. So pubocervical ligament are again two here on either side, and the transverse cervical ligament again they are in pair. Then behind there is also one important ligament. This is called as the uterosacral ligament. This is between the uterus and the sacrum. So that's why it is called as the uterosacral. Again this is in pair. So all these ligaments, there are ligaments in the front, and there are ligaments behind, and there are ligaments on the sides. So all these ligaments are pulling in different direction. So all these ligaments, when they pull from all the sides, then the structure will be intact in its position. Okay, so that's why these ligaments are very important, and these are fibromuscular in nature. And apart from that, you have already seen the round ligament of the uterus, that is also an important fibromuscular structure which will be helping in the support. So these are the primary supports. The primary supports are divided into two types, muscular as well as the fibromuscular. The muscular will be pelvic diaphragm, which you can see here, then the perineal body, then the urogenital diaphragm deep inside. The fibromuscular will be the pubocervical ligament in the front, the transverse cervical ligament on the sides, and the uterosacral ligament behind. Apart from that, the round ligament is also there, and apart from that, the uterine axis itself is very important for the support of the uterus. Now going to the secondary type of supports. So this is just showing you the different primary supports. You have already seen the axis, anteflexion and anteversion. This is very important for the pull of the uterus on either side, and then it will be keeping in its normal position. Then to differentiate between the pelvic diaphragm as well as the urogenital. This is the urogenital diaphragm, and deep inside here is the pelvic diaphragm. Okay, so on either side this is the pelvic diaphragm, and this is the urogenital diaphragm. All these are keeping this uterus as well as the vagina in its position. Then you can also see this is the round ligament, which is pulling in the front for the uterus, and behind this is the uterosacral ligament. This is the transverse cervical ligament on either side, which is pulling it on. So all these ligaments pulling in different direction keep the structure in its position, and this is the transverse cervical ligament. This is how it looks like. Okay, and this is the uterine axis. So these are all the primary supports. Apart from that, the secondary support, there are also secondary support. These are nothing but the peritoneal folds. Peritoneal folds, as you know, peritoneum is a very thin membranous structure, so it cannot hold the uterus when there is actually, especially during pregnancy, when it expands to such a large extent. At that time, the thin peritoneal fold cannot help in supporting the uterus. So that's why these are called as secondary supports or peritoneal ligaments, which as I said, because they are very thin and very thin membranous structures, so their value, even though we have put it in secondary, even whether they are secondary or not, it is doubtful in nature. Okay, so but still we mention them as the secondary. These are as we have already seen, the broad ligament, which is on either side, then the uterovesical fold in the front, and then the rectovaginal fold behind. So all these folds will be acting as the secondary supports of the uterus. These are nothing but the peritoneal folds. Okay. And here you can see here, this is just to show you how exactly is the broad ligament. So if you imagine, this is the fallopian tube. So this is the same tube, a part has been shown, and there is a fold of peritoneum hanging, going all the way and cover the whole of the fallopian tubes, and again hangs back. And in the posterior layer of this broad ligament, there is the extension of the same, which form the meso-ovarian, which is nothing but the mesentery for the ovary. okay, which is from the posterior part of the broad ligament. We have already seen that the ovary has a mesentery, or which is called as the meso-ovarian. That is nothing but the fold of the peritoneum, which is coming from the broad ligament, posterior layer of the broad ligament. Now going to some important highlights of the histology. We will not go into the details of the histology because it needs a separate lecture. So just we will be briefly introducing the histological features. So as you know, the uterus is divided into three layers. When you take a section of this uterus, wall of the uterus, then we can see differentiate the three layers. So the first layer will be called as the endometrium, which is the innermost and the most important, especially during implantation and other things. So this is called as the endometrium, even during the menstrual cycles. So these are the changes which will be taking place in this whole part. So again, this endometrium is divided into different layers. Will not go into detail, and this is the it is lined by simple columnar epithelium, and there are uterine glands and different other features. Will not go into detail. So this is the endometrium, a thick layer of endometrium. The next layer is outside this endometrium. So this is from inside to outside. The first one is endometrium. After that, there is a thick layer of muscular layer that is called as the myometrium. So only a part of it has been shown here. If not, it will be a very thick layer with actually three layers of the three different layers. So which will be in different directions. Okay, so that is a very thick layer of the myometrium will be there. So that's what is called as myo. Myo means muscle, metrium is the layer. Then we have outside, the most external layer will be the thin peritoneal fold, which is covering the uterus, that will be called as the perimetrium. So the outermost will be the perimetrium, the second layer will be the myometrium deep inside, and the innermost, which is in the cavity, that will be lined by a layer of layer of simple columnar epithelium, that will be called as the endometrium. So the outermost lining of this endometrium, thick layer of endometrium, will be the simple columnar epithelium. Okay, so this is how it looks like when you see in the microscope. Will not go into detail what are the features. This is how the endometrium will be changing during the menstrual cycle. Okay, so this is the next layer, that is the thick endometrium. Then outside we have the perimetrium, which is peritoneal layer. Now coming to the blood supply. Blood supply of this uterus is by main two arteries. Those are called as the uterine arteries. So these are this is the uterus, and beside that, the body of the uterus, you can see a tortuous artery, very tortuous artery. This is called as the uterine artery. Why it is tortuous? Because whenever if there is pregnancy, as I said, the uterus enlarged to a very large extent. At that time, even the artery has to stretch itself and supply the uterus. So that's why it is highly tortuous artery. So that is how we can identify this artery. This is called as the uterine artery on either side. So there are two uterine arteries, each on each side. Okay. So these are there from the anterior division of the internal iliac artery. Okay, then the second important artery will be by the ovarian artery. So partly it will be supplied. So here you can see just below the uterine tubes, the uterine artery will be anastomosing with that of the ovarian artery. So partly even the ovarian arteries on either side will be supplying the uterus. So uterine arteries are direct branches from the abdominal aorta, just like the testicular arteries. So the uterine arteries as well as the ovarian arteries will be supplying the main arteries which supply the uterus. So as we have seen, uterine artery is a very tortuous artery. Usually in the viva, the examiners tend to ask whenever they come across such kind of arteries, so they will usually ask which are the other arteries in the human body which are tortuous. So apart from the uterine artery, there is the facial artery, which is very tortuous, because whenever you chew as well as smile and other things, again there will be the artery has to expand at that time. So that's why the facial artery is very tortuous. And the second important artery which is tortuous is the middle meningeal arteries. Then the third important artery is the occipital artery. Then the fourth is the splenic artery, and the last and but not the least is the uterine artery. So these are five important arteries which will be tortuous in the body. One is the facial artery, second is middle meningeal artery, the third is the occipital artery, the fourth is the splenic artery, and the fifth is the uterine artery. Now now coming to the venous drainage. The venous drainage is by a plexus of veins which are around the uterus. So these plexus of veins will be draining finally into three important veins. One is the uterine vein, the second is the ovarian vein, and the third is the vaginal vein. Depending on the particular side, these three veins will be formed, and these veins will be actually draining especially the first and the third, that is the uterine vein as well as the vaginal vein, will be draining into the internal iliac vein. What about the ovarian vein? Ovarian vein has a very typical nature. It is different on right and left side. On the right side, it will be draining into the inferior vena cava itself directly, and on the left side it will be draining into the left renal vein, and from there into the inferior vena cava. So that is the typical nature of the ovarian vein, just like the testicular vein itself. Apart from that, the uterine vein and the vaginal vein will be directly draining into the internal iliac vein. So this is about the venous drainage. Now coming to the lymphatic drainage. So this again has a very typical nature. The lymphatics from the fundus and the upper part of the body of the uterus will form a upper lymphatic system, and they will drain directly into the aortic group of lymph nodes, as well as even partly into the superficial inguinal group of lymph nodes. But the lower part of the body will be draining. It forms the middle lymphatics, and it will be draining into the external iliac group of lymph nodes. And the lymphatics from the cervix, which form the lowermost lymphatic, that will be draining into the external iliac group of lymph nodes, internal group of lymph nodes, as well as the sacral group of lymph nodes. So this is the typical nature of this uterus. Even though it is a single body, but the upper part of the body as well as the fundus will be draining into the aortic. The middle, that is lymphatic, that is the lower part of the body, will be draining into the external iliac group of lymph nodes, and the cervix will be draining into the external iliac, internal iliac, as well as the sacral group of lymph node. This is very important. Again, clinically it depends on the carcinoma, so where exactly the location is there. So depending on that, you have to see the group of lymph nodes which might be involved. So you should know the exactly area where the carcinoma is there, and you have to look for those group of lymph nodes specifically. Coming to the nerve supply is again by the autonomic nervous system from the inferior hypogastric as well as the ovarian plexus, by both the components, the sympathetic as well as the parasympathetic. So these components are very important. Especially the parasympathetic is very important during pregnancy, because it helps in the uterine inhibition and as well as the vasodilatation, because the nutrition required there is a huge one. So uterine doesn't contract, so it helps in the staying of the keeping the pregnancy intact. The second is vasodilatation, which helps in the nourishing of the fetus as well as the placenta and other things. And it is pain sensation, especially in the cervical part, the cervix part. Okay, this is from the S2, S3 and S4. And the sympathetic component is very important during the parturition, during delivery, because this helps in the uterine contraction, as well as even sometimes there are some remnants of placenta and other things to throw it out. This sympathetic component is very important. So this helps in the uterine contraction as well as the vasoconstriction, as well as it is pain sensation from the body of the uterus. So this is from the T12 and L1. So this is about the nerve supply of the uterus. Coming to the vestigial remnants. During the development of the uterus, there will be some remnants which will still remain even after adulthood. So these are, one is called as the oophoron. So this is the oophoron part. Then this is the parophron, And then we have the duct of the oophoron. This is also called as the Gardner's duct. This is also called as the Gardner's duct. This is the whole duct. And the fourth one is the vesicular appendix. So if you can see in this picture, there is near the fimbriated end of the fallopian tube, there will be vesicular appendix. The details about this will be dealt when we deal about the development of the uterus, which will be a separate chapter again. Coming to the final part, that is the applied anatomy. The first one is the retroverted uterus. As I said, the normal position is the anteversion and anteflexion. So instead of that, if it becomes reverse, if the instead of anteversion it becomes the retroversion, that it will be diverted behind. That leads to a lot of complications in the female, which might be noticed or unnoticed. That is, one is the dysmenorrhea, which is a very common symptom, but they might not be knowing the exact cause. This is one of the causes, retroversion of the uterus. Then the dyspareunia, then the sterility, as well as the backache, which is again, backache is very common in the case of female, as well as the menstrual disturbances, which are common. So one of the causes, there might be many causes for all this, but one of the cause might be the retroverted uterus. Okay. The second is the endometriosis. So this is the inflammation of the endometrium, the inner layer of the uterus. After endometritis, the third important clinical aspect of the uterus is the malignant growth. You should remember that the carcinoma of the cervix is the commonest carcinoma in case of the female. So it amounts to almost 11%. Next comes the carcinoma of the breast. So the commonest carcinoma in case of female will be the carcinoma of the cervix. So there is a very important clinical finding in case of carcinomas. The fourth important after carcinoma is the benign growth in case of the female. There is something called as fibroid uterus, or it is also called as the fibromyoma, because it is a fibrous structure which develops within the myometrium. So if you see this picture, so here you can see there are these are the different sides of fibroid uterus. So it can be intramural within the muscle, or it can be within the lumen, protruding into the lumen, or it might be outside into the subserosal surface, or even in the cervix, and different sites. So depending on that, it has specific names. So in general, this is called as the fibromyoma, or it is also called as the fibroid uterus. And this is one of the cause of the sterility in case of the female, and dysmenorrhea, bleeding, and other features with which it will be presenting. So it is a benign growth, nothing much to worry unless it is causing sterility in case of females, or repeated abortions and other things. So at that time you should take care. If not, it is benign. But the malignant growth of the cervix, which is the most commonest, will be dangerous. Coming to there is something called as the endometrial biopsy test. This is especially done by taking out a part of the endometrium in the form of biopsy to exactly locate or determine the ovulation in case of the sterile females, especially if they want to go for some procedures which will help in the fertilization in case of the sterile female. So at that time they try to determine the exact day of ovulation by taking the biopsies, regular biopsies. As I had discussed before, the Cesarean section, which is nothing but the abdominal delivery of the baby by a method called as laparotomy. So this is done by two methods. One is the classical method. This is the old method, where the incision used to be done vertically, and it used to give a big scar. But nowadays they do the LSCS, where the scar is horizontal. Okay, so this is how you can easily determine even by externally whether they have done the classical method, adopted the classical method or the LSCS. As I said, LSCS is the lower segment Cesarean section, where they will be taking a incision on the isthmus of the cervix. Coming to the next clinical aspect, there is something called as the hysterectomy. That is, in case of the carcinoma and other conditions, they totally remove the uterus along with the fallopian tubes. So this is called as the hysterectomy. You should be able to differentiate this hysterectomy from the hysterotomy, where there is only difference of a C. This is a hysterectomy where they totally remove the uterus, mostly usually along with the fallopian tubes. Nowadays they leave the fallopian tubes along with the ovary, because the ovary will be secreting important hormones. So this hysterectomy should be differentiated from the hysterotomy, where there is only the difference of EC and here OTOMI, where there is EC is missing. So hysterotomy. So this is just opening of the uterus and doing whatever procedures. If you want to do some kind of for the fibroid uterus, something like that, if you are just opening, or even in case of the LSCS, Cesarean section, where you open the uterus, that is called as the hysterotomy, when they just cut and open the uterus and then close back. But hysterectomy, ectomy means total removal. So ectomy, and this is just tomy. Tomy is just cutting, and ectomy is total removal. After cutting, it is removed. Okay, so that is the difference between the hysterectomy and hysterotomy. Then there is something called as the hysteropexy. This is nothing but the fixation of the mobile or misplaced uterus. Sometimes what happens when the ligaments are, as we have studied the supports of the uterus, which are the primary ligaments and secondary ligaments. So the primary ligaments sometimes get stretched and then sometimes even get cut, and that leads to misplacement or the displaced uterus. At that time they do something called as the hysteropexy, where they will be putting it back in its normal position. Then there is also a procedure called as the hysterosalpingography. Again, this is done usually in case of the sterile ladies, where they want to see the patency of the uterus as well as the fallopian tubes, as well as if there is any constriction or division which are the abnormal. Sometimes there might be septas inside, so that you will study when you study the development. So to find out any abnormality, developmental abnormality, or there can be a total the patency of the fallopian tube as well as the uterine cavity. So they pass a dye through the vagina. We have already studied when we studied the fallopian tubes. So they pass a dye through the vagina, and from there into the uterus, and from there to the fallopian tubes, and there will be spilling of this dye into the peritoneum, and they will take the x-rays. This is called as the hysterosalpingography. Hystero is uterus, salpingo means fallopian tubes, and graphy is the study. Okay. Then we can also one of the procedure of the temporary contraception is by something called as the intrauterine contraceptive devices, IUCD. Intrauterine contraceptive devices, which is a temporary method of sterilization by something called as copper T or Lippis loop and other things, where they can prolong, or they can keep the gap between the two children by temporary sterilization by intrauterine contraceptive devices, IUCDs, like copper T loop, Lippis loop and other things. Finally, coming to the prolapse of the uterus, as we discussed before, the supports of the uterus, especially the primary supports, which are muscular as well as the fibromuscular, if they get damaged, and that might lead to especially the pelvic floor as well as the perineal body, which are the main muscular supports. If they get damaged, and that leads to something called as prolapse. So this is a picture depicting the same. in case of the prolapse, the uterus will be actually invaginating into the vagina itself. Okay, so the prolapse can be of the uterus itself, sometimes even it can be of the rectum as well as the uterine bladder. But the most commonest which is seen in case of the female is by the prolapse of the uterus. And this might lead to a lot of complications like dragging pain, severe pain, then sacral backache, leukorrhea, whitish discharge, then the urinary stress incontinence as well as the cystocele, rectocele, many complications, bleeding, and other complication might arise from the prolapse of the uterus. So the axis here they have shown you the axis should be perfect to prevent the prolapse, and there are these the supports also, especially the muscular and the fibromuscular. Among that the perineal body as well as the pelvic floor plays a very important major role, damage of which might lead to prolapse of the uterus. Okay, so these are some of the applied aspects or the clinical aspects related to the uterus. So this is all about the uterus. If you have any doubts, you can definitely write to me and I will try to answer. So these are my references. Thank you very much. If you like this video, you can click the like button, and if you want regular updates and if you want to go through more of my YouTube videos similar to this one, then you can subscribe to my channel to get the regular updates. Thank you very much.